Good afternoon, everybody. Thank you all for joining us. I just wanted to make a note up front that we unfortunately had a last-minute change with my co-presenter who was unable to join us this afternoon. And so Joy Smith with Ahead, I'm sure some folks are familiar with Joy, very graciously agreed to step in and help us. And help me in particular as we get to talking more about the Social Security and of working and individuals with disabilities working. So I'm going to work through the beginning portion of this, and then I'm going to hand it to Joy to give us some information related to Social Security and working and earnings. And then, as Caroline said, please put questions in the chat as we go. And then when the two of us are finished, we're going to have time, hopefully, for some questions. So I wanted to start with just some information about the Health Law Project. So if there are folks joining us, who are not familiar with who we are and what we do and how we can be a resource to people. So the Health Law Project is a statewide nonprofit law firm, and our work focuses on helping people access public health insurance programs and accessing healthcare through those public health insurance programs. So when we talk in Pennsylvania about public health insurance programs, we're talking about Medicaid, or what we call medical assistance in Pennsylvania, talking about CHIP, the Children's Health Insurance Program. And we also help people, especially low-income individuals, with Medicare, or people who may have or be eligible for both Medicare, and Medicaid. The primary way people get to us is through our helpline, and you see that number on the screen there, the 800 number. Anybody can call the helpline. So somebody can be calling on their own behalf, a family member, a social worker, medical providers, anybody can call us. Our services are free. And then we provide, the extent of assistance that, an individual might need. So somebody may be calling and just need some basic information about how to apply for Medicaid, or ask some questions about whether they think, we think they might be eligible. We have expertise in the Medicaid eligibility system. So we're able to guide people, through the possibilities that they could be eligible for Medicaid or not, direct them to how they can apply for Medicaid. And that might be all somebody, a given caller needs. Or people could be calling because they've been denied a service through Medicaid or through one of the Medicaid managed care systems, and they're looking for advice or actual representation in appealing a denial of services. And so that work could, be more involved and could last, a couple of months, depending on, the individual situation. And then separate from, or in addition to, the direct client work that we do, and really often from that client work, we also do policy advocacy, primarily at the state level, sometimes at the federal level, with the Department of Human Services and the offices that make up that Department of Human Services. And work with them on improving various parts of the Medicaid system, and including things like Medicaid home and community-based waiver services. And then the third kind of piece of what we do is what we're doing today, community education. We do in-person trainings, we do a lot of webinars, we have a monthly newsletter. And please email me. My email is, I think, on that first slide. Anybody's not getting our newsletter electronically and would like to, please just send me an email, and I'm glad to get you on that list. And for the monthly newsletter. And then we also have lots of written materials that we've created. And there's a link there to our resource library on our website. So just, a bit about Health Law Project, who we are, what we do. If it's related to public health insurance programs, either on the eligibility side or accessing services or problems with services, denials of services, those are all the right times to call us at the Health Law Project. Okay. So we're going to talk today about Medicaid and specifically two categories of Medicaid, or again, what we call medical assistance in Pennsylvania. So in order for anybody to be eligible for Medicaid, they have to fit a category of eligibility. And there are many categories, and this list is not even probably all inclusive. But many different ways somebody can be eligible for Medicaid. And then those different categories have different income limits. They have different income counting rules. Some categories have, in addition to income limits, also resource limits. Some do not. So it's, a complicated, unfortunately, eligibility system. But kind of the starting point is, looking at how what category might somebody fit in, and then, kind of going from there to determine might they be eligible for, one or more given categories, because people actually could qualify for Medicaid, in more than one way. So, you see here, kids are a category, and they're actually broken up into 3 different age groups: pregnant women, adults 19 to 64 without Medicare. So lots of different categories of eligibility. So we're going to focus today, though, on two categories: on MAWD and on MAWD for workers with job success. So MAWD stands for Medical Assistance for Workers with Disabilities. And people who are potentially eligible for Medicaid in this category. And I want to maybe just back up, because occasionally we have folks call us who already have Medicaid, but they're calling to see if they can get onto MAWD. MAWD is Medicaid. So it's just a way to get Medicaid. And so, if somebody has Medicaid in some other category, then they've got Medicaid. That they don't need to go into this category in particular, because this category, unlike every other category of Medicaid, but these two we're going to talk about, has a monthly premium. So people don't need to be in this category unless they don't fit any other category. So MAWD is for workers with medical assistance for workers with disabilities. The criteria: it is for people between the ages of 16 to 64. When somebody on MAWD turns 65, they unfortunately age out of this category. As the name implies, workers with disabilities, the person has to be both disabled or have some type of, significant chronic health condition, and be doing some type of paid work. This category of Medicaid has a very high income limit relative to all other Medicaid categories. And that income limit is at 250% of the federal poverty level. The federal poverty level, as the name implies, is determined at the federal level, and generally changes every year, usually by the third week or so in January of the new year. We'll find out what the new income, what the new federal poverty limits are for, that coming year. And then there's also a criteria for resources under this category. So an individual has to be under the income limit of 250% of federal poverty, and countable income. And we're going to talk about what that means when we say countable income. And then the individual also has to have resources less than $10,000. resources meaning things like money in a checking account or a savings account or retirement account, in any type of investment. All of those things that somebody may have, one or more of together are considered resources, and they count towards eligibility. So medical assistance for workers with disabilities. So what does it mean for somebody to meet that criteria of disabled? If somebody is receiving Social Security disability insurance already, a monthly Social Security check from the Social Security Administration, that means they've already been determined disabled and meet the definition for this category of Medicaid as an individual with a disability. So anybody receiving SSDI, Social Security Disability Insurance, automatically can kind of check that box for, am I considered disabled or not for this category? But somebody doesn't have to be receiving Social Security Disability Insurance to meet the disability criteria for this category of Medicaid, for MAWD. So if they're not getting Social Security Disability Insurance, then when they would apply for MAWD, presuming that they meet, all that other criteria in terms of their age and, of course, a Pennsylvania resident, they're under the resource limit, they're under the income limit. If somebody's applying then for MAWD, who's not getting Social Security Disability Insurance, they would just need to provide medical documentation of their condition or conditions, in the case of certainly folks having more than one, significant or chronic health condition. And generally, it's a condition that's expected to last for, 12 months or more. And then at the Medicaid level, there's what's called a medical review team that will look at that medical documentation that's submitted and determine whether or not that person meets, that really the equivalent of the Social Security definition for a disability. And so just, some of the ways people can provide that documentation, could be with, a treating physician, a doctor's letter, a psychiatrist's letter, depending, of course, again, on what the condition is, indicating, what the diagnosis is, what treatment, the duration of this condition. And then there's also something that the Medicaid system uses, a form called the health sustaining medication form. That can be helpful in determining whether, in having a doctor complete that form, so that then the medical review team within Medicaid can determine, does their health condition meet that, that threshold, that definition of a disability. And so for folks taking medication or medications for one or more, chronic health conditions, then that health sustaining medication form would be helpful. And it's a simple one-page form, not too onerous on doctors to complete. And then submitting that form could be, enough to then have that person determined disabled by the Medicaid medical review team. Okay. So again, the name is Workers with Disabilities. So as the name implies, the person has to be eligible, has to be both working and disabled. So in order to meet the work requirement, people don't have to be working a certain amount. They just need to be working monthly. So they don't have to be working, 20 hours a week or X number of hours a week or a month. They can be doing work that's, a typical job where you do the work, you get a paycheck, you have a pay stub, you have proof of, who's employing you on that pay stub and how much you're earning, your gross earnings, your net earnings, a typical kind of job like that. Or somebody could be doing something, much more informal. They could be doing work for a neighbor, for a relative, for a friend. Um, we've worked with many clients over the years who came to us trying to see if they were eligible for Medicaid, were otherwise over income or over resources or both for every other category of eligibility. They were disabled, perhaps already on Social Security disability, but were not working. And we advise people about this category of Medicaid and, encourage them to think about, is there something they could be doing for somebody that they could get paid to do, and they could do that monthly? Sometimes people say to us, well, I'm already babysitting my grandchildren, or, things they may already even be doing, that if they could get paid, even for some of that time, and then have that in writing from the person they're doing that work for, that would be sufficient. So we've helped many people over the years, get on MAWD who, when they came to us, weren't working, but took the opportunity to think about, well, is there something I could be doing, and what? And would somebody be willing to pay me to do whatever that is? And then that person employing you, paying you, just needs to put that in writing. What are you doing? How often are you doing it? What are they paying you? Is it $10 an hour? Is it just a flat rate of $25 a month? And you're doing something for them once a month or twice a month. And that person that's paying you and employing you is going to sign it, date it, put their address, their phone number, so that the county assistance office, you're going to submit that to the county assistance office. If they have any questions or they feel the need to verify what's written, they can call that person. And that is enough to meet that work requirement. In addition, of course, as I said, to somebody just, having a typical job, with a paycheck and a pay stub. Okay. So I said earlier, that the income limit was for MAWD was at 250% of the federal poverty level. And that's the countable income. And so what the system means by countable income varies depending on the source of the person's income. So for purposes of MAWD eligibility, somebody's income is either earned or unearned, or certainly people can and do have both income from both sources. So when we're talking about unearned income, that's somebody who's receiving Social Security disability insurance or SSR, Social Security retirement. You see unemployment compensation, workers' comp, a pension. All those things are considered, for purposes of, how income gets counted for MAWD, considered unearned income. And so the countable income for somebody's unearned income is their gross monthly amount minus $20, just a small standard $20 disregard. Otherwise, we're looking at gross monthly minus that $20. However, earned income for MAWD eligibility and MAWD purposes is counted much differently. Earned income is the person's monthly gross income before any taxes or anything taken out. Their monthly gross income. From that, $65 is subtracted, and then half of the remainder of that amount is counted. And then that's their countable income for MAWD eligibility purposes. So let's just look at example, because I know at least that's how my brain works, to see it laid out concretely. So in just this made up example that I'm using, Michaela is single. She's received Social Security disability insurance. So in her case, Social Security has already determined her disabled. So for that piece of the eligibility criteria for MAWD, that box is checked. She's already been determined disabled. Nothing more has to be provided in terms of proof of her disability. The proof has already been determined by Social Security. So she's getting SSDI. Her gross monthly amount is $1,820. And then she's also working, and her gross monthly earnings are $465 a month. So what's her countable income? We separate out her unearned income from her earned income. Unearned is that Social Security monthly amount. All but $20 of that gets counted. So it's $1,820 minus 20. Her countable unearned income for MAWD purposes is $1,800. Then we look at her earnings. That's, pay from her job. That's earned income. Take that $465 monthly gross, subtract $65, not quite sure why $65, but that's the amount. That's what the rules say. Leaves us with $400, and then count only half of the remainder of that. Half of 400 is 200. Then we combine those two, pots of income that she has. Her countable Social Security is $1,800. Her countable income from her job is $200. Those two together is $2,000. So in determining whether or not Michaela is under the income limit for a single person in 2024 for MAWD, she's well under that countable income limit, because for 2024, a single person, that income limit is again 250% of federal poverty. That amount for this year is $3,138 for a single person. So she's well under that income limit. And so from an income standpoint, and she's working, she's disabled, as long as we know that Michaela has less than $10,000 in checking, savings, any resources that she has, then she's going to be MAWD eligible. And her income is such that she would not be eligible for Medicaid in any other category unless she qualified for Medicaid home and community-based services. Otherwise, she's over income for any other way to qualify for Medicaid, but eligible for MAWD. And then, as I said earlier, one distinction with MAWD and the MAWD for workers with job success categories, unlike any other category of Medicaid, there is a monthly premium. That monthly premium is based on the person's countable income, so not their real gross, but that calculation we just did for Michaela. In her case, that countable income is $2,000 a month. The premium with MAWD is 5% of that countable income. And so in 5% of $2,000 is $100 a month. So in this case, in order to have Medicaid under the MAWD category, Michaela would have a monthly premium of $100, and she would need to pay that and keep up with that payment, or she would lose her MAWD. She would get a notice that she's behind on those premiums. She would need to pay them. If she doesn't pay them, then her Medicaid would be terminated. If a person is married and applying for MAWD, their spouse's income is counted in determining their eligibility. If the person is eligible, then their premium is just based on their own income. So in this case, if Michaela was married, we counted her spouse's income using the same calculations we just did for Michaela's. Add those two together, If they're under the income limit for a household of 2 for MAWD, then she's still eligible, and then her premium would still be the same amount of $100. So spouse's income counts in determining eligibility, but not counted when determining what the person's monthly premium is. That premium is based just on the income, the countable income of the applicant. And then, as I indicated earlier, there is both an income limit for MAWD and a resource limit. Resources have to be less than $10,000. That is the resource limit, whether somebody is single or married. So unfortunately, there's not a higher resource limit if the person applying is married. It is still that maximum of, $10,000. And again, when we talk about resources, the Medicaid is not counting, the home the person lives in, whether they own it or not. They're not counting one car. They're not counting things like somebody's household possessions or their furniture or their jewelry. Those things aren't counted. They don't count things like an ABLE account, which is basically a type of Pennsylvania special needs account and trust where people with disabilities can put their money. That's not counted in determining whether somebody's resource eligible for MAWD. So what they are counting is, generally what's considered people's liquid assets, meaning money in a checking account, money in a savings account, money in retirement accounts. Even if taking that money from that retirement account would involve a penalty, that amount still gets counted towards a person's resources, minus what the penalty might be. If people own property other than where they're living, a rental property or land somewhere, the value of that does get counted as a resource. And if people have more than one vehicle, the more expensive vehicle can be deducted, discounted as a, not counted resource. But then the value of that other vehicle can be counted in determining, whether or not somebody's resource eligible for MAWD. Okay. So let's move from here. And again, folks, please send questions into the chat. I'm deliberately not looking at them. And thank you, Caroline, because I know she is. But if there are questions as I'm going along, please put those in the chat, and then we're going to get to as many of those questions as we can, when Joy and I are both done. So let's talk now about MAWD for workers with job success. And this is a category that's just been around now in Pennsylvania in the last couple of years. And we really have this category thanks to some very diligent and impressive advocacy by consumers, by people who are working, disabled, likely getting Medicaid through MAWD, and had opportunities to earn more and opportunities to save more, but were, being limited by those income limits and those resource limits with MAWD. And so as a result, the state agreed that we would basically expand the MAWD category, into a second category that is referred to as MAWD for workers with job success. So who's eligible under this category? And what are the income limits? What are the resource limits? So in order for somebody to be eligible under this MAWD for workers with job success category, they first had to have been on MAWD for at least 12 consecutive months. It certainly could be longer. It could be years that they were on MAWD, just so there was at least a period of 12 consecutive months prior to then, applying to, be in this category because their income has increased. The person then has to be within the income limits for this category, MAWD for workers with job success. Still need to be between the ages of 16 and 64. Again, this category ends, if somebody's in this category, they do unfortunately age out of it at 65. Countable income is between 250% and 600% of the federal poverty level. And you see what those amounts are for 2024 on your screen, depending on whether the applicant is single or married. And I should have mentioned this with MAWD. Unlike many other categories of Medicaid, MAWD only has what's considered a household of one or a household of two. So the person is single, they're a household of one. A person married living with their spouse who's applying, they're a household of two. Even if there are dependent children in the household, other people living in the household, and for the categories of MAWD and MAWD for workers with job success, there is no, household beyond a household of two. You're single, and so you're a household of one. You're married and living with your spouse, you're a household of two. If you have one child living with you as well, or two or three, it doesn't increase then to a household of 3 or 4 or 5. It's household of one, household of two. And so you see what those income limits are, between that 250% of federal poverty up to 600%. And then the individual's resources still has to be under $10,000 to be eligible for this category, to move from MAWD to MAWD for workers with job success. So basically, this is allowing people who have been on MAWD for at least 12 consecutive months and now are, have an opportunity perhaps to earn over the countable income limit of the 250% of federal poverty. They've got an opportunity for a new job. They have an opportunity for a raise, a promotion or a different job within the same place they're working. But that income would put them over the MAWD income limit of the 250% federal poverty. If that new job, that new raise, that new opportunity puts them over the 250%, but still under the 600% of federal poverty, and their resources are still under the MAWD limit of $10,000, then that person can move from MAWD into MAWD for workers with job success. Once somebody is determined eligible for MAWD, meets all that other criteria, for MAWD for workers with job success, then their resources there's no resource limit after that. So it's the income that has to exceed the 250% after somebody being on MAWD for at least 12 consecutive months, while their resources are still under $10,000. If that happens, then somebody's eligible for MAWD for workers with job success. And once they're moved from MAWD into this workers with job success category, then there's no longer a resource limit. So, and that's, I think, an important piece. We've had a few clients over just these last couple of years who, are calling us because, their resources are over 10,000 and they're on MAWD, or they're getting close to being over 10,000. And they've heard about this category and think this will be what will make a difference for them. But their income was still under that 250% of the federal poverty level. Unfortunately, they cannot move from MAWD to MAWD for workers with job success because their resources are now getting close to or over $10,000. It has to be the income that exceeds the MAWD income limit. Then the person gets moved into this workers with job success category. And once that happens, now that person can have more resources and perhaps start saving more or putting money into a retirement account. But not until they've first moved from MAWD to the workers with job success category because their income exceeded the MAWD limit. And then once people move into MAWD for workers with job success because they meet all of that criteria, then they do have, just like with MAWD, they have a premium. It's a higher premium than it is with MAWD because people now are earning, more. It could be a lot more money. So that premium is determined then by, again, their countable income using that same, the same rules about how earned income versus unearned income gets counted. And then if that income is between 250% and 450% of federal poverty, their premium will then be 7.5% of countable income. So for MAWD, it's 5%. For MAWD for workers with job success, when somebody's income falls between 250% and 450% of federal poverty, then their premium is going to be 7.5% of their countable income. People whose income exceeds that 450%, they're at 450% between the 450 and the 600% of federal poverty, and they have an adjusted gross income, that's over a certain amount that gets, determined by Medicaid every year, then their premium is the full premium, whatever it costs the state to provide that insurance. I think the last figures we saw were for 2022. And so in 2022, that full MAWD premium was $948 a month. But again, keeping in mind that, people's countable income, is really getting high now if they're working and their earnings are over, 450% of federal poverty, but still under 600%. They are then paying that full MAWD premium. Okay. I'm gonna pass it over to Joy now, and because we know and we hear from folks when they're calling us that are receiving Social Security disability, and perhaps we're explaining MAWD to them, for the first time, and that's a way that maybe the only way that they're potentially eligible for Medicaid. We often get that question of, but if I'm working, then isn't that going to impact my Social Security benefits? Aren't I in jeopardy of losing my Social Security that people often have had to fight to get? It's not easy to be determined disabled by Social Security. It's involved. It's a process. It can take months or longer. And so I've heard many people ask us and almost panicked about, but I can't work. I can't work. I was only able to get Social Security because I can't work. And I had to prove that. So now you're telling me that I can work to get Medicaid, but then isn't my Social Security at risk? And the answer is not necessarily. It is not necessarily. There's, of course, always devil in the details. And so Joy's gonna talk through some of that for us now, and then we're going to open it up to questions. And as I said, try to get through as many questions as we can, be it about MAWD or MAWD for workers with job success, or what about how working impacts my Social Security benefits. All right, so I'm going to turn it over to you, Joy. Thank you so much.
Not a problem, Janice. Thank you for asking me to attend and present a little bit on Social Security benefits and working. Just to give you a little bit of background, my name is Joy Smith, and I work for AHEAD. AHEAD's a private nonprofit agency here in Pennsylvania. And we have one of the funding sources we have is a grant from the Social Security Administration to provide benefits counseling. Benefits counseling is basically where we talk to you about how work affects Social Security benefits, what you need to do, how to report earnings, kind of the whole, deal with Social Security benefits and working. We've been doing this since 2001. So hopefully people on the call, I see we have a number, almost 358 participants. Hopefully most of you have heard about benefits counseling, but if not, the next slide is going to tell you a little bit more how to get benefits counseling. But I'm going to go through a little bit here on earnings and Social Security benefits. This is specific to Social Security disability insurance. So that's key because the Social Security Administration has two different types of disability benefits, SSI and SSDI. We're going to focus today on SSDI. If you're on Social Security Disability Insurance, SSDI, you have something called a 9-month trial work period, where during that 9 months, you can make as much money as you would like, and you would still keep your SSDI benefit. Now, a couple things to think about when you talk about the 9-month trial work period. It doesn't start unless you earn a certain amount of money. So if you see from the slide there, this year, the trial work period amount is $1,110. So if if you're starting a job here in October, November, and you make $1,200, that's going to be your first trial work period month. But if you're going to only make maybe $900, that's not a trial work period month. You physically have to earn the $1,110 a month for it to count. You do have a 60-month period in order to accumulate these 9 months. I know that gets very, very confusing. What that really means is if you, let's say, try out a job now and use 3 or 4 months, and then for whatever reason, you're not able to work or not able to work at that amount for another, 55 months, Social Security is not going to count those 3 or 4 months that you've already used because they don't feel it's a good representation of your work activity. But keep in mind, if you do use the 9 months in that 60-month period, then the trial work period is complete. One of the other things I'll mention about the trial work period is if you've been on Social Security disability for a few years and you've worked periodically, you might have used some of this 9 months and did not know about it. And if you've completed the 9 months 5 or 6 or 7 years ago, that is still on your record. Even if you're going to go get another job, a completely different field, anything like that, if you've completed the 9 months, you do not get a new 9-month period. So that's something key to remember. And when we do benefits counseling for folks, we get something called a benefits plan inquiry from the Social Security Administration. And that BPQY goes through the trial work period. It lists out, did that person use that? So if you go through benefits counseling, and we can answer those questions to see if that 9 months was used. But this is a great work incentive for people. I talk to people all the time about this, and they're like, really, I can keep my full Social Security check for the first 9 months that I work. And it doesn't, Social Security is not going to take that money back. No, it's exactly what it sounds like. It's a trial period, just so you can try out the job, see how it goes. A lot of times I get asked, how did benefits counseling start and why are we out here doing this? Because you could go to the local Social Security office and ask these questions, right? And you can do that. But Social Security 20-some years ago realized that a lot of times people want a little bit more, interaction from local social service agencies, those types of things. So they recruited agencies like Ahead and others throughout the country to give you this information. This is all that we do, is benefits counseling for people that are interested in working and on benefits. When you go to the local Social Security office, they're dealing with a lot of different things there. You know, grandma passed away, we got to stop her Social Security benefits, or, you know, this gentleman's retiring and needs to start his benefits, or you're applying for your disability benefits. That all happens at that Social Security office. So those folks there are pulled in a lot of different directions. So Social Security wanted to prioritize this, really, and have specialists out in the field like us that are just trained on this area. And I can tell you from doing this for, 20 some years, we are busy. There are a lot of people that have questions, want to go back to work, can work, and sometimes have to work because with the prices of everything, they need to be bringing extra money into their household. So these are all good things that Social Security wants to empower people and have them be more financially successful. And I think that's part of the whole MAWD program as well. Through our benefits counseling, we talk a lot about MAWD to folks. We promote it because it is a great option for folks, so that they can continue to receive their medical assistance while they work. Now, a lot of people say, well, okay, that 9 months sounds good, but what happens after that? Well, that's always the question. So after the 9 months is over, you go into something called an extended period of eligibility. Oh, what does that mean? So that means you have another 3 years that Social Security is going to keep your case open while you're trying to work out there and see how you do. Now, with that, though, if you're earning above something called substantial gainful activity, which for this year is $1,550 gross per month, you would not get your Social Security check after the 9 months are over. But if you're below that income limit in any of those months during that 3 years, you're eligible for your Social Security benefit again. So you're still open. You don't need to reapply, nothing like that. You just need to keep in communication with Social Security to let them know how much you're earning so that they know whether to start or stop your check. So this is really nice. So this gives you 9 months plus 3 years to see how things go for you. One of the things I mentioned there is keeping in communication with Social Security. I give you a lot of information in these presentations, and I always try to say, well, if you can remember one thing, this is it. If anyone is on the call and they're working, you need to be reporting your Social Security benefits, or I'm sorry, your earnings to the Social Security Administration. So if you are on Social Security benefits and working, you need to be reporting monthly how much you're earning. Even though you're working and they're taking taxes out and you see that listed on your pay stub, it doesn't go through Social Security system quick enough. So you need to be reporting it on a monthly basis. There's a few ways you can report your earnings. You can do it over on Social Security's website if you have an account there. You can do it on the mobile app on smartphones. You can do it on a telephone reporting, which is where you call in and give them your information. Or you can do it the old school method of mailing or faxing or dropping them off at the local Social Security office, your pay stubs. Social Security does prefer one of the first two, the electronic methods. Obviously, it goes through the system quicker, but you can, if those don't work for you for whatever reason, you can go and, fax it, mail it, drop it off, what have you. So that's a lot of information about SSDI. And I wanted to touch on one other point because I did see it in the chat. And Janice, there are a lot of questions here, so I'm going to wrap up here sooner rather than later. But someone mentioned about using some deductions when you're looking at your gross earnings for the MAWD premium. You can also use deductions when you're have completed your 9-month trial work period and you're in that 3-year extended period of eligibility. If you have things called impairment-related work expenses, Those are things that you need to purchase related to your disability that are, you're paying for out of your pocket. So let's say you're working and you're making, just for example's sake, $2,000 a month, and your 9-month trial work period is over, then your SSDI check should be stopping. But let's say I'm not able to drive. Maybe I have to take an Uber back and forth to work or public transportation. And then I also have co-pays for my medications. And those all total $600 a month. So instead of Social Security saying, well, Joy's out there making $2,000, she's actually making $1,400. So that brings me below the substantial gainful activity. And I keep my Social Security check if Social Security approves those deductions. So these are great things. Not everyone has them. Some people have a lot. Some people have a few. It all depends. But through benefits counseling, we walked through this with people. We kind of ask key questions about, how you get back and forth to work, different deductions that might be possible for that person. Janice, I think you said there was another slide. Can you?
Oh, sure.
Direct me. There you go. Yeah. So I saw, and I glanced over. So where is benefits counseling available? I saw that. So benefits counseling is available throughout the United States. AHEAD is just here in Western Pennsylvania, but there's benefits counselors all throughout the country. You can go to Social Security's website, Ticket to Work, and it'll tell you a lot of information on some of the work incentives we talked about today, and how to get connected to a benefits counselor. You can go right there. I'm also going to give you a phone number, and I'll try to type it in the chat, but I've learned from before, I can't talk and type at the same time. So I'm going to say it first, and then I'll put it in there. You can call the Ticket to Work helpline. And that phone number is 866-968-7842. And if you call the Ticket to Work helpline and say, I receive Social Security benefits and I am working and I need benefits counseling, or I would like to work and I need benefits counseling, they're going to ask you some questions, get some basic demographics. They can look into Social Security system a little bit to confirm your, benefits and whatnot. And then they're going to say to you, okay, we can refer you over to the local benefits counselor. They're going to call it a WIPA, W-I-P-A. And that's just the contract that we're under with Social Security. But they're going to refer you over, and then the benefits counselor in your territory is going to get that referral, and then they'll contact you. And then we start services right from then. There is no waiting list for services. We're reaching out to people within the first 5 business days of receipt of that referral. And if you call the Ticket to Work helpline today, they refer you over the same day to us. There's no wait. I will say this as well. There are 4 benefits counseling programs here in Pennsylvania: AHEAD, Disability Rights of Pennsylvania, Full Circle, and Appalachian Regional. So just for very rough territory, AHEAD covers most of Western Pennsylvania into the Harrisburg, Central PA area. Disability Rights of Pennsylvania covers the northeastern area. And then Full Circle covers just Philadelphia. I shouldn't say just. The Philadelphia area is very populated, so they're busy. And then Appalachian Regional covers the counties that border West Virginia here in Western PA. So like Fayette, Washington, Greene. But you don't have to worry about that. You contact the helpline and they will route you to the correct person, and then you'll get a call, and we can start services. So this is something that, like I said, if you're on this call, you're not working and you're working and you've never had benefits counseling, please call the helpline. This is information that you can use. It's not saying that, you have to work full time or anything like that for people that are worried, well, if I ask questions, then what's going to happen? This is strictly for your information. This doesn't mean you have to go to work tomorrow or anything like that. So just glanced over. There is no cost for using AHEAD for benefits counseling. We are funded either by the Social Security Administration. We have some other funders as well. So likely there would be no cost to you. That is all I wanted to say, I think.
Thank you so much, Joy. I so appreciate it, especially, since I reached out to you at like, I don't know, 10 o'clock this morning. So I really appreciate all the wealth of information that you shared. Caroline, I'm going to bounce to you and see if we have some questions that Joy or I can try to answer.
Yes, we do have some questions. First question is, if I get a part-time job 3 days a week, how will that affect my MAWD and SNAP benefits?
So I can't answer the question about the SNAP benefits because unfortunately that's not our area of expertise. So yeah, so that's a question for, probably, the county assistance office. If somebody's working, how will it affect their MAWD? If they're already on Medicaid in the MAWD category, then it will just depend on, like, is that person now working more? If they're going to 3 days a week, then you'd want to, pay attention to, how much more you're earning. What's that countable income? Are you still under that countable income limit for MAWD? And you want to report that change of income. And then if you're working more and earning more, then your MAWD premium will likely go up, again, based on what that person's countable income is.
Another question, does MAWD follow the estate recovery program the same way Medicaid does?
It does not. And Medicaid generally does not have an estate recovery program. The estate recovery program only applies to people who receive Medicaid and by getting care in a nursing home, or who have Medicaid and are receiving and are enrolled in one of Pennsylvania's home and community-based waiver programs, and the person is 55 and older. So there is no estate recovery otherwise tied to Medicaid. So, millions of people on Medicaid in Pennsylvania, they might be on Medicaid for 6 months. They might be on Medicaid for 60 years. There isn't any estate recovery. There isn't any, clawback that once that person dies, that then the state Medicaid program is entitled to, any estate they may, a home they leave behind, or any money that they have when they die. That does not apply to any category of Medicaid except Medicaid for people in a nursing home when they're 55 or older, and Medicaid when people are receiving, and enrolled in one of Pennsylvania's home and community-based waiver programs, like the Community Health Choices waiver, or the OBRA waiver, or the autism waiver, one of the intellectual disability waivers. That's the only time estate recovery is a factor when somebody has Medicaid.
I'm 58 years old and already on MAWD. I don't qualify for workers with job success since I have a 10,000 asset limit. I'm unable to save for retirement, including taking advantage of my company's 401k. Since this will make my income very limited during retirement, I'd like to know what happens to my coverage when I turn 65. Do I change to Medicare? Since I will need to keep working forever, I won't meet income guidelines for any Medicare assistance programs.
So as I said, unfortunately, and I would actually personally love to see this change, and perhaps with advocacy, it can. But right now, both the MAWD and the MAWD for Workers with Job Success categories of Medicaid do end when somebody turns 65. And I imagine designed that way because for many people, if not most, uh, they become eligible if they're not already on Medicare prior to age 65 tied to a disability, they become eligible for Medicare at age 65. So unless there's another way that somebody's eligible for Medicaid, on MAWD, turn 65, age out of these categories, whether they're in MAWD or MAWD for Workers with Job Success, then in terms of their insurance options, they're really looking at, Medicare. Unless of course they're, still working and have insurance, health insurance available and affordable, through their employment. But otherwise then, yeah, people are relying on Medicare and Medicare Advantage plans, perhaps a Medicare supplement, sometimes called a Medigap policy. But yeah, unfortunately, when people age out of MAWD, it often then means they don't fit any other category of Medicaid.
All right. And can a MAWD participant who currently has regular Medicare and a Medicare secondary plan obtain health insurance coverage that is not an Advantage plan? In other words, keep their regular Medicare and receive a Medicaid plan that is not limited like Medicaid plans are.
Yes, if I'm understanding the question correctly, and if I'm not, please email me afterwards. But if somebody has Medicare and Medicaid, whether their Medicaid is in the MAWD category or some other category, they do not have to enroll in a Medicare Advantage plan for their Medicare coverage. Medicare and Medicaid being, two totally different insurance programs that people are eligible for different sets of, different reasons. So if somebody has Medicare and has Medicaid, they can have their Medicare with just their Medicare card, with their Medicare Part A and Part B. A is the hospital coverage, B is the outpatient doctor coverage. And then they can just enroll in what's called a standalone prescription Medicare plan, a Part D like in drugs. And that's how they get all their Medicare benefits. And then they have their Medicaid secondary. In that situation, their Medicaid secondary, their Medicaid is in a managed care plan. And currently there's a choice of 3 Medicaid managed care plans. But Medicare is always the primary insurance over Medicaid. Medicaid's always considered the payer of last resort. So absolutely, somebody who has Medicare and Medicaid does not need to enroll in a Medicare Advantage plan. They can have their Medicare with just their red, white, and blue Medicare card and need to have a Medicare drug plan, which is a Part D plan.
And why aren't the people who answer the PA statewide social services trained in MAWD?
Yeah, that's just a good question without a good answer. I think there's probably many reasons. I talked to a client's mom this week that just got repeated bad information about MAWD. This was a mom like researching, trying to figure things out herself, and still could not get to somebody in this. I think she had called both the statewide center and spoke to people at the county assistance office, gave her bad information about how earned income is counted with MAWD, did not know anything about MAWD for Workers with Job Success. I think there's likely, multiple reasons for that. As you can see, just these 2 categories of Medicaid can be complicated on their own. I think I think we don't have enough staff that at the county assistance offices to manage the complexities of these programs, and they are managing SNAP benefits and cash benefits and LIHEAP benefits and all those benefits that are all part of what those county assistance offices have to be, trained in. People need good training on all of these, good supervision. It's very unfortunate, and unfortunately we hear about too often, or people call us and we educate them about MAWD, and that often say, why didn't anybody tell me this at the county assistance office? And it's very unfortunate, and I don't have a good answer. The system is just does not work like it should, or perhaps could.
All right, and can MAWD be used by someone with severe mental health, for example, schizophrenia?
Yes, in terms of that, medical assistance for workers with disability, in terms of that disability criteria, if somebody's, again, already receiving Social Security disability insurance, perhaps because of a mental health condition like schizophrenia, then they already meet the disability criteria. If that person is not on Social Security disability insurance, but dealing with, what can be a very significant mental illness in terms of schizophrenia, they would, when they would apply, if they're otherwise eligible for MAWD, income eligible resource between 16 and 64, working, doing some type of paid work, then when they would apply for MAWD, in addition to completing the application and providing things like proof of income and driver's license, all those kinds of things, then they would want to provide the medical documentation for that mental health condition, and perhaps use like that health sustaining medication form, and ask their doctor to, to complete that and include their diagnoses and medications that they're taking, and why they need to continue to take those medications to even be able to work. Or certainly other, other medical documentations, a good letter from a doctor or psychiatrist. But yes, absolutely.
Do you need the doctor's letter and PA 1671, or is it one or the other? Our county assistance office always requests the employability form, which is a confusing form for physicians and patients. Is that form necessary?
That form should not be necessary. And I actually deliberately left that employability assessment form off of my presentation for the very reason that the person just asked that question, because it is a confusing form, because the form, the form I think was really created for doctors to complete to show that their patient, because of their health conditions, cannot work or is expected to not be able to work for less than 12 months or 12 months or longer, or indicate that they're permanently disabled. So it's not a very helpful form, just as the person is indicating. So yeah, I don't I don't suggest that form for people that we talk to. I don't know that any of the county assistance offices, it certainly might be what they send people or direct them to. But again, unless the doctor understands that, in order to be determined disabled, and of course have to be working, the doctor wants to check on there that the person's disability is expected to last 12 months or longer, or they are permanently disabled, but indicate, they are still able to, to work. Because unlike the Social Security system, at least when people are trying to apply for Social Security disability, whether or not somebody can work and how much and their earning potential, that is tied to the criteria to get disability initially. As Joy explained, it doesn't mean then people can't work or go back to work or, explore those options. But MAWD is not based on, an inability to work. Obviously, it's really kind of quite the opposite. It's saying you can be working and disabled and then still get Medicaid. So I would kind of steer away from that employability assessment form, and use something like the health sustaining medication form, or other medical records or, documentation. Because the person who asked the question is exactly right. That employability assessment form is confusing. Because you're basically asking the doctor to say, no, my patient can't work. And at the same time, having to show Medicaid, oh, I am working.
If someone has MAWD and then applies for a home and community-based waiver, does the eligibility guidelines change to what is required for HCBS opposed to the guidelines for MAWD?
That's an excellent question. It's an excellent question, and one I could have certainly included a slide or two on in the presentation. If somebody applies for, somebody's on MAWD, they apply for home and community-based waiver services, and that is a category of Medicaid in and of itself, and it has its own income limit and its own resource limit. For 2020, the resource limit's $8,000. The income limit for waivers for this year, I should know it, $2,829. Gross. It's gross. There's no deductions. There's no countable income for waiver. It is what it is to the penny. Your gross amount has to be under $2,829 a month for the applicant, and they only look at the applicant's income, not spouse if they're married. So if somebody's income is over that income limit for the waiver, but under the income limit for MAWD, same with resources. Maybe their resources are more than 8,000, but as long as they're less than 10,000, then the person is still financially eligible for the waiver if in fact they've been determined first clinically eligible for a home and community-based waiver program. This is an area we've actually tried to do some work on at the state level because I think the software system that the county assistance offices use isn't sophisticated enough to pick up on this. And so if somebody's now getting financially determined eligible for a waiver, and let's say they, their income is $3,000 a month, and that income is, a combination, say, of Social Security and a job, if that combination still then has you under the MAWD income limit, that person should be determined eligible for, for the waiver, as long as they remain eligible for MAWD. Certainly, if people are seeing problems or people getting terminated or denied the waiver, who are working and perhaps on MAWD right now, please reach out to us. Please call our helpline, because we've absolutely seen cases where people were denied waiver or were at risk of losing their waiver because their income was over the waiver income limit, but in fact, they were on MAWD and under the MAWD income limit. Thank you for asking that question. That's a really good question.
Thanks, Janice. And we dropped in the chat our fact sheet for more about the special MAWD HCBS eligibility rule. The next question is, you said that someone applying for MAWD can use their SSDI award letter as proof of income as well as proof of having a disability. Does that mean a medical assessment form is not needed?
Correct. There is no medical assessment form that is needed when the person who's applying for MAWD or even renewing MAWD because they're already on MAWD, there is no medical assessment form. By virtue of the fact that somebody is getting, SSDI, and again, it needs to be SSDI. So for example, people can collect Social Security retirement beginning at the age of 62. If my income from Social Security is Social Security retirement, that's just showing I've worked, paid into, and took my retirement at 62. That's no reflection on what my health conditions might be. But if the person is receiving Social Security disability insurance, that there is no medical assessment form, no medical documentation at all. That, like I said, that box is already checked. Am I working? Am I disabled? You've got Social Security disability, you're disabled. There's no questioning from the county assistance office, and the county assistance office workers should not be asking you, have your doctor fill this form out or send some other, nothing else should be needed.
Can someone on MAWD also have the state pay their Part B Medicare premium? And can they qualify for extra help benefits?
Another great question. In order to have MAWD and qualify for the state to pay your Medicare Part B, be like in boy premium, there are two separate benefits. And for somebody to have both of them, and this is not true if somebody's just trying to get the state to pay, to see if they're eligible for the state to pay their Part B premium. In order to have both full Medicaid, whether it's MAWD or some other category, and be eligible for the state to pay the Medicare Part B premium, the person's income and resources has to be under, their income has to be under 120% of the federal poverty level. It's referred to as the SLIMB category. And their resources have to be under the resource limit. So I'm looking at my cheat sheet for 2024. If that person's single on MAWD, also trying to see, am I eligible for the state to pay my Medicare Part B premium? Their countable income, and the same rules are used for countable income for this benefit, this Part B buy-in benefit. A single person's countable income has to be under $1,506 a month. Their resources have to be less than $9,430 a month. So their income has to be much less than that MAWD maximum, and the resources are even a little bit lower than the MAWD maximum of $10,000 to be eligible for both benefits, the full Medicaid and the state paying their Part B premium. Great question.
Right. And Janice, I just wanted to check in for time, if you're still okay to answer questions. We still have questions coming in.
Sure. Let's at least try to answer a couple more. And of course, if there are folks on that, need to drop off, then of course, drop off. But yes, I'm glad to try to answer a couple more questions.
All right. The next question is, do Social Security back payments count towards the asset limit?
Great question. For Medicaid purposes, when somebody receives what Medicaid refers to as like the lump sum, and that's probably what the person's asking in terms of back payments. That happens typically more often when they apply for Social Security disability. They're, let's say they apply this month in October of this year, they don't get a decision until June of next year. But in that decision, Social Security says, yes, it took us till June to decide that Janice is disabled, and we determined Janice was disabled back to, October, or she was disabled before that. I applied in October, but I showed the records and the medical documentation that I've been dealing with some significant health condition, for maybe a year before that. So I provide all that documentation. I apply in October, no decision till June. Social Security says, Janice, based on everything, yes, you're disabled. And we determined you're disabled back to January of that year you applied. And so then you're entitled to, after a waiting period, you're entitled to get whatever they determine your monthly benefit is that you're entitled to get that back payment. And so, you know, again, Medicaid generally refers to it as that lump sum amount. So Security is going to start to pay you forward now every month, whatever that amount is that you're entitled to, and they're paying you back retroactively. The Medicaid system has some allowance built in for that, and it's a 9-month period. So for 9 months after the month after, I believe, you receive that lump sum payment from Social Security, for following 9 months, Medicaid will disregard that. So maybe you're on MAWD, maybe that lump sum was $15,000. And pretty much that's what you have is 15,000 you just got, no other assets. You have the income, the resource limit for MAWD's 10,000. You have 9 months to, you know, to get those, if that's your goal, to get those resources under 10,000 before Medicaid, I apologize, before Medicaid will count that lump sum amount.
All right, and we have 2 questions about household size for MAWD. What if you are a household of 2 but not married? And when you said the household is either 1 or 2, do you mean if you have a household of 3, you can't qualify for MAWD?
Oh, no. Yeah, thank you for asking that, because that's definitely not what I meant. You could have a household of 3 or 10 and still be eligible for MAWD. It's just, and again, I can't explain really or don't know the history of why this MAWD and MAWD for workers with job success is structured this way. But for MAWD purposes, you are only a household of 1 or you're a household of 2. Even if in fact your household is you, a spouse, and 3 kids. So you think, well, no, I'm a household of 5, right? Well, yes, you are, but not for MAWD purposes. For MAWD purposes, you're a household of 1 because you're single, or you're a household of 2 because you are married and living with your spouse. That's it. So yes, I may be an actual household of 5 because I have a spouse and 3 kids, but when I apply for MAWD, there is no income limit for a household of 5. It just goes up to a household of 2. So in that case, married, 3 kids, I'm a household of 2 for MAWD purposes. Not true for other categories of Medicaid. So, you know, it gets confusing. But yes, it's a household of 1 or a household of 2.
All right, and the last 2 questions have to do with being on one category of Medicaid and switching to MAWD. So if a person is already receiving Medicaid but wants to work, can they transition from regular Medicaid to MAWD so they can work and not lose their benefits?
If they meet all of those MAWD criteria. So again, are they between 16 and 64? Are they disabled? Are they receiving Social Security disability? Then yes, they're disabled. Or if they're not, what are their health conditions? Might those health conditions, when documented, like with the health sustaining medication form, will show Medicaid, yes, I have a chronic significant, health issue. Am I working? Are my resources under $10,000? Am I under that countable, income limit? For me, if I'm a household of 1, or for me and spouse combined, if I'm married, living with my spouse, and I'm a household of 2. So yes, but again, somebody has to meet that criteria. You can't, just go over the income limit for, let's say, a single adult getting Medicaid in, what might be called the MAGI category. I go over that income limit. I can't move into MAWD unless I'm working, disabled, and, you know, meet the rest of that criteria. Like I'm not going to be able to move over into MAWD if I'm 65 or older.
And we have a Social Security disability question for Joy. Is notification needed for the trial work period?
I'll answer that two different ways. So do you need to notify Social Security that you're using the trial work period? No. When you're reporting your earnings, they're automatically going to put you into the trial work period. And then the other way is, does Social Security notify you that you're using it? Yes, they are now. They never used to, but now they are sending out letters, probably, 2 to 3 to 4 months into the trial work period. They're going to send you a letter saying, hey, you've been using this. We're expecting this to end for you at this month and year. So yes, that does happen.
Okay. And Joy, I'm sorry, and so people should be reporting their monthly income.
Always report your earnings to the Social Security Administration if you're on any type of Social Security benefit. Yes.
Right. Thank you, Joy and Janice. Those are all of the questions.
Right. Caroline, thank you so much. Joy, thank you. Thank you to everybody who's been listening in. Thank you for all the questions. And again, you have my email, my phone number. If other things pop up or you have questions, for yourself, somebody you're working with, call our helpline, call me, email me, and we'll certainly do our best to get back to you or answer any of your questions. Thanks so much, Joy. You were a fabulous pinch hitter. I'm a baseball girl. Caroline, thank you as always.
Thanks, Janice. And just a reminder, I think we'll also circulate a survey.
Oh, thank you so much. Absolutely. Thank you so much, Caroline. I had a note to myself and still clearly ignored it. Because this particular presentation was funded by the Pennsylvania Developmental Disabilities Council, part of their requirements from the federal funding they receive is to send a survey after we do a presentation like this. So we will send that out probably, if not by the end of today, tomorrow. If folks can take a couple minutes, that would be so appreciated. And we know the Disability Council appreciates it as well. Thank you, Caroline, for that reminder. All right, everybody, enjoy the rest of your day. We've got sunshine in Pittsburgh. I hope you have it where you are. Take care.